Hi, I'm Dr. Shane Howell with Alternative Health Management, and I'm going to give you my updated little home exercise routine. And these are for most of my patients that I recommend. If you are not one of my patients, I recommend you consult with your doctor before doing any kind of exercise. So just to kind of really scale back and allow it, scale back time-wise so people can do these without feeling overwhelmed with the exercises. And this will cover your neck or cervical spine, your mid-back or thoracic spine, your shoulders, your low back or lumbar spine, and your hips. So I'm kind of working on improving the posture, improving the flexibility and movement of those areas as they work together. So the first thing I just do is just kind of stand up nice and straight, kind of engage my abs. I'm like tight my abs without squeezing them in. And so I just put my hands down by my side and I'm going to swing my arms nice and controlled. As far up and back as I can go, and the other one's going back as far as it can go at the same time, and I just keep reversing. And I do that for about 10 seconds. Then I go pull one up and over as I squeeze the other one in, and just keep reversing nice and controlled. I do that for 10 seconds. Then I bring my hands up and I go in and out, in and out, in and out. Okay? Then essentially I kind of do some similar things with the legs. So nice, good posture, tighten my abs. You might want to do this next to a wall or something stable so you can catch if you have balance issues. So I might do it like this, and I'm going to swing my leg back and forth for 10 seconds. And the other way, back and forth. Obviously you can't do both legs at the same time. You fall on your tushy. The next one is in and out. Do that 10 times, the other one 10 times. Then I'm going to rotate like that. It's like I'm pointing the knee in and out 10 times. In and out 10 times. Okay? So the next one I'm going to do is I'm going to put my hands behind my back, and then I'm going to squeeze my shoulder blades together, and like I'm pulling down towards the floor. If you can't do this, just put your hands behind your back, rotate your hands and thumbs back, and then reach down to the floor. So otherwise, lock your fingers, squeeze your shoulder blades, pull down. I like to tighten my glutes and my abs at the same time. And what I do is I slide forward and back with the neck. I'll count to 10. Then I'll like slide side to side. So it looks like this. Not like that, but more like I'm pushing the ear one way to the other. Count to 10. Then I'll rotate 10 times each way. Okay? And it's also important when doing all these exercises to make sure you're breathing. Always be breathing. Because a lot of people hold their breaths when they're working out, which is not a good idea. You'll pass out. So back to that. Forward and back, slide side to side, and then rotation 10 times. Just make sure you're really squeezing those shoulder blades together, because that's going to really transform your posture. So the next thing I'm going to do is tractions. Okay, so I'm going to grab something stable, and you can actually use a door frame, and prefer something where it's like my palm is face down, but I'm just going to use this as an example of this be like a door frame. What I'm going to do is like pull away as I hold on, and as I get that kind of nice pull and stretch, I'm going to gently roll my shoulder as far forward and far back. So focus on rolling the shoulder. A lot of people get more of the body, and they're not really doing much with the shoulder. So focus on that ball in that socket. I do that about 10 times, and at the end of that 10 times, I hold it one way for about 10 or 20 seconds, and then go other way. Hold it 10 or 20 seconds. Then I do the other side. Okay? The next thing I want to do is I'm going to go down to the floor. So preferably a softer floor if you have a carpet floor or something like that, or at least like put a yoga mat down or something like that. Come down to the floor, leg I get up on my forearms, just kind of right underneath my shoulders. I tighten my glutes and tighten my abs. That kind of protects your low back. Then what I do is I lift up through my upper back and shoulders, and I hold that. Make sure my neck is neutral. I'm not looking up, and I'm not tucking my chin. And I'm actually pulling my head, sliding my head back, like the back of my head is going towards the ceiling. And I just hold that. You start out about 20 to 30 seconds or whatever you can. And I have most people like try to work up to where you're literally holding this for 2 minutes. This will really help change the position of your low back, and it also helps with your stabilizing your shoulder blades. The next thing I want to do is grab your foam roller, which I recommend all my patients get one of these. You can get these at pretty much any store these days. Academy, Walmart, even Five Below, whether they're $5. They're a little bit shorter, but that's all you need. So essentially what I'm going to do, I'm going to sit down on the floor, legs straight out. I'm going to raise it up above my low back. So I don't want to do this on my low back, my lumbar spine, because it's going to push your lumbar and increase the curve, which you don't want to do. So up where my ribs are, I'm going to kind of set down, and then I'm basically going to lie over it and hold it and breathe. Start out with about 10 seconds, but over time, over doing this each day, eventually you want to get up to like at least 30 seconds. And after 10 seconds, curl up, move it up a little bit so you can roll up a little bit where it goes up your spine, and do the same thing. 10 seconds, breathing and relaxing, curl up, let it roll up another inch or so, same thing. And I'm going to just keep working my way up my back. When I get to where my shoulder blades are, I got to get those out of the way. They're kind of in the way. So I'm going to basically hug myself, like grab the back side of my shoulders. And so I'm right in between my shoulders. By the time I get to in between my shoulders, I'm same thing. And you're going to stop before you get to the knot at the bottom of your neck. So you're not going to get to the neck. You're going to be below the neck. So you're only doing what's called your thoracic spine or your mid-back. And that essentially helps to improve your overall posture. If you see most people's posture, they're flexing forward. So we call it kyphotic spinal position, and that puts a lot of strain on your low back, your shoulders, and everybody complaining about their shoulder tightness and neck tension and headaches and everything. So it's something that I personally do every day because it's going to improve the flexibility. Also, making sure the movement in your thoracic spine is going helps a lot with shoulder strength and flexibility. So the next thing I want to do is a stretch for essentially the front of the hip, or the opposite of the glutes. We call it basically the hip flexor, which actually is a group of muscles. The psoas is the main one, which connects from your down through your lumbar spine, inside the cavity of your pelvis, down to the front of your hip. And its main function is to flex the hip, hence the name, hip flexor. And so when we sit all the time and drive and sit at a computer, it's basically held in a contracted or tight position, so we need to work that out a little bit. So basically I'm going to come down. Ideally, I like to do this kneeling now. I feel like it gets a better stretch, but you can also do this standing, and I'll show that here in a second. If you can't get down on your knees, it's too much tension on your knees or whatever. So basically I'm going to come out a little bit to where I get a nice stretch through here and through the front of my thigh. I'm going to take my hands straight up in the air. I'm going to go basically reach. And then from there, I'm going to gently rotate away just a little bit and then tilt away. Still make sure you're breathing. So it's going to get all this plus all of that. Stretching it out. And so I hold that about 20 seconds or so. And then essentially turn around and do the other side. Reach, tilt away. Hold it 20 seconds. I usually like to do that 2 times around, okay? So next one I like to do is to help strengthen the glutes, which is chronically weak in a lot of people because, again, we sit a lot of times, and when we sit, essentially turns off that muscle. So we got to get that muscle activated because it's so important. It's literally the strongest muscle in your body. It helps you when you walk and run, helps you getting up and down from a chair, climbing stairs, things like that. So I'm going to essentially lie on my back. This is going to look like a starting position of a crunch, abdominal crunch. What I like to do is bring my heels close to my body, because then that takes less stress on the hamstrings, which is the muscles on the back of the leg. And basically what I do is I lift my pelvis first, and then lift that whole thing at once, okay? And you should feel it. You can put your fingers back on your backside there and feel that muscle tight. It should be tight. And you can either just hold it, and I'll hold it. You can start out for like 10 to 20 seconds, but then work up to where you do it for at least a minute. And what I personally do is I like to do one leg at a time, because they, in many cases, work individually. So basically lift one leg, and so I'm just working this right side. So I'm doing the same process, and I just hold it. Okay? And then I reverse and do the other side. And I usually do, it's a good idea to do a couple of sets of that, where you just hold it for whatever you're going to do, 10 or 20 seconds to start out with, rest for 20 seconds, and then do another set. Okay? Then I come up, and stretch. Okay. The last one, what I like to do is a stretch that's going to stretch essentially the whole backside of the legs. So think of a stretch for your calves, which is the back of your lower leg. And what I like to do, come over here for a second. Find some kind of step to where the ball of your foot is a little higher than your heel. So you see how like it essentially like that, and I basically take my other foot and go forward. And lock my knee. I make my leg straight, and I push my hip back. And then I just hold that. I'll usually hold it about 20 seconds. Then I'll do the other side. Then what I do is I like to contract that muscle 3 or 4 times, and also contract the hamstrings, which is bringing your heel towards your rear end. I do that 3 or 4 times. Then I go back and do that same stretch. When you mix in a little bit of contraction within the stretch, it makes it loosen up a little better. So that's a good overall routine. It shouldn't take more than about 10 or 12 minutes to do the full routine. I do recommend, if you've got a lot of chronic daily issues, recommending doing that at least twice a day. But try to start out with once a day if you can. All right? If you have any questions, just give us a call. 713-722-2580 on Alternative Health Management on the west side of Houston. Take care.